Hey everyone, and welcome back to the channel. Today, we're diving deep into the human body with a classic anatomy quiz question. This one's all about the femur, your thigh bone, and how it connects to your knee, ready to test your knowledge. Let's get started. Here's the question. Which structure is found on the posterior or back aspect of the femur and serves as an attachment for the knee's lateral collateral ligament? Is it A, the lateral epicondyle, B, the medial epicondyle, C, the linea aspera, D, the adductor tubercle, or E, the greater trochanter? Take a moment to think about it. Lock in your answer. If you need a hint, the lateral collateral ligament, or LCL, is that tough band of tissue on the outside of your knee that prevents it from bending outwards too far. All right, have you got your guess? The correct answer is A, the lateral epicondyle. Let's break down why. The lateral epicondyle is a bony prominence on the outer side of the femur, right near the knee joint. It's the perfect anchor point for the fibular or lateral collateral ligament. This connection is absolutely crucial for stabilizing the knee during activities like walking, running, and jumping. So, if you chose a fantastic job. Now, for those who might have picked another option, let's quickly review the other choices so we can learn from them. This is how we really make the information stick. Option B was the medial epicondyle. This one is close. It's on the opposite side, the inner side, of the femur. It's also an attachment point for a major knee ligament, but it's for the tibial or medial collateral ligament, often called the MCL. So, medial epicondyle for the MCL, lateral epicondyle for the LCL. It's a key distinction. Next up, we had option C, the linea aspera. This is a prominent ridge that runs down the back of the femur's shaft. It's not really involved in the knee ligaments directly. Instead, its main job is to serve as a major attachment site for your adductor muscles, the ones that pull your leg toward the midline of your body. Then there was D, the adductor tubercle. The name gives this one away. It's a small bump located just above the medial epicondyle, and it serves as the specific insertion point for a part of the adductor magnus muscle. Again, it's all about muscles, not the LCL. Finally, we have E, the greater trochanter. This is a large, bony landmark you can actually feel on the side of your hip. It's located way up at the top of the femur and is a vital attachment site for powerful hip muscles like the gluteus medius and minimus, which are essential for hip stability and movement. So, it's a hip structure, not a knee ligament attachment. And there you have it. A quick but detailed tour of some key landmarks on the femur. Understanding these attachment points is fundamental to understanding how our lower body moves and maintains stability. I hope this breakdown was helpful and cleared things up. If you enjoyed this little anatomy lesson and want more content like this, be sure to hit that like button and subscribe to the channel. Drop a comment below to let me know if you got the answer right. Thanks for watching, and I'll see you in the next video.